So before I start, I want you guys to know that I've been working on this PPT, this lecture for the past 2 months, and just 3 days back my laptop crashed and hard disk stopped working, and I lost all my data. Luckily, I had around 500 slides में से 250 slides का backup, so it was all gone, but थोड़ा सा बचा था. So in the last 3 days, I've been working very hard, so I can
rebuild it just the way it was.
Slide by slide. So in the last lecture, I talked about osseointegration, in which we prepare the osteotomy inside a bone, we place the implant, and if that implant doesn't move for the next 3 months, it gets osseointegrated. The bone forms around the implant in these macroscopic imperfections and the microscopic imperfections. So this connection is purely physical. It doesn't allow the implant to move. Okay, and I showed you the comparison between the natural tooth and the osseointegrated tooth. The main difference you guys need to understand is there is no gap, there is no space between the bone and the implant, whereas in the natural tooth and the bone, there is a space, that is pedial space, and these pedial fibers, they act as a cushion. Okay, so when these implant or the tooth, they are under occlusal forces, masticatory forces, the tooth, it can go down, it can move up to around 28 to 30 microns, whereas implant maximum 5 microns move hoga. Okay, so this difference in movement, this will come into play later on in the complication section. Okay, and then I told you about fibro-osseous integration, fibrous integration, where if the implant during the healing phase is moving, then it leads to fibrous connection between the bone and the implant, and that is not desirable. Okay, then I talked about different types of implants based on material, based on the position, whether they are subperiosteal, whether they are inside the bone, that is endosseous, or crossing the bone, going through and through the bone, that is transosseous implants. These are endosseous that are placed inside the implant. Implant in this endosseous, we have cylinder form and tapered, and another we have threaded and non-threaded. Then we have blade forms and root form. This is a blade form implant, and this is root form implant. Okay, so in the implant placement, I told you first step was implant placement. Of course, we place the implant inside the bone, we wait for a few months, then we prepare the soft tissue also around the implant so that it can receive the prosthesis. Once that is done, we go for the impression technique. Then after impression is taken, we pour the cast. Once the cast is poured, crown is fabricated or the prosthesis is fabricated, and then finally the prosthesis is delivered. Okay, these are the steps that we're going to cover. I talked about the different types of bone given by Carl Misch, D1, D2, D3, D4, and depending on the density of the bone, RPM, handpiece में जिस speed पे बर घूम रहा है, that is decided. So D1 2500, D2 2200, D3 1600 RPM, D4 1200 RPM. Okay, so where do we see all these bones? Anterior mandible D1, D2, posterior mandible D2, D3, anterior maxilla D2, D3, posterior maxilla D3, D4. Okay, just remember this Z pattern. So how do we evaluate the amount of bone, the density of the bone? There are different methods. Of course, radiographically we can measure the bone, IOPA, OPG, but IOPA and OPG, they have one most major disadvantage, that they have magnification. In IOPA it is around 7%, but to be on the safe side, we can assume that there is 10% magnification and then measure the length or the dimension, whatever you're measuring. In OPG, we can assume around 30% magnification, and you can use the metal ball for calibration. I've already talked about all of these. Then we can use CT scan, cone beam CT or CT scan. These are the most accurate, and they give you a 3-dimensional picture of the bone. Okay, whereas in OPG or IOPA, they just give you an anterior, posterior, or mesodistal dimension, not the buccolingual dimension. Okay, and another thing that you can go for is, if you don't have the option of CT scan, along with OPG and IOPA, you can use bone calipers. Okay, then implant should be placed in a bone that is healthy, sufficiently dense, and sufficient width and height. I've already talked about density. I've talked about what does it mean by sufficient height and width. Basically, two implants, the distance between two implants should be at least 3 mm distance between the implant and the adjacent natural tooth should be 1.5 mm, and distance between the implant and the inferior alveolar nerve should be 2 mm. Okay. Now I am disappointed by you guys, even not only you guys, the PGs also. Nobody asked me why this dimension, sir. Okay. Now there is no major blood supply, major artery here. Okay, they are getting, in case of mandible, they are getting the blood supply from the periosteum and this inferior alveolar artery. Okay, from here. So if this distance is less, what happens is the blood supply of this bone, the bone that is between the two implants, is compromised, and that leads to necrosis and failure of the implant. Okay, bone necrosis हो जाएगी तो implant कहाँ टिकेगा. Okay, the same goes for this. Why this distance is less? Because यहाँ से भी blood supply आ रही है, so you can reduce the distance. Okay, so that is the reason we need to keep a 3 mm bone between two implants, and 1.5 mm at least bone between the implant and the natural tooth. Then I told you earlier, it was the concept that we need to keep a distance of at least 2 mm from the sinus or nasal floor. Now the concept is that we should engage the cortical bone of the sinus floor or the nasal floor. Okay. Buccally and lingually, there should be at least 1 mm bone on both the sides. And in mental foramen, in case of mental foramen, if you are placing an implant close to mental foramen, it should be at least 5 mm anterior to the mental foramen, because there is something called as anterior loop of the inferior alveolar nerve. And because of this, we need to keep, this is the mental foramen. So 5 mm anteriorly we should keep it to protect the nerve from injury. Okay. I showed you all the instruments of the implant surgery kit. Now, there are many hundreds of dental implant system in the world, and every implant system is going to have somewhat similar kit. Okay. कुछ में instruments ज़्यादा होंगे, कुछ में कम होंगे, but the underlying principle is the same, that we drill the bone, first we mark the bone, then we drill the bone, we place the implant. Okay. Every kit is going to have this torque ratchet, every kit is going to have drills, every kit is going to have parallel pin. Okay. हो सकता है the shape or the dimensions of those drills and parallel pins might be different in different kits. Okay, but the underlying principle is always the same. Okay, so these are all the instruments. I've already shown you the instrument. I've shown you that these markings have a significance. They have the markings that first marking is 8 mm, second is 10, 11.5, 13 and 15. I've shown you this drill that I use is a little bit tapered because of the implants the company provides is tapered. Okay, so it automatically creates a tapered osteotomy. Okay, so this dimension that is written here 4.9 and 4.4, that means upper diameter is 4.9 but the apical diameter is 4.4. Okay, so these burrs, these kits are to be used with physio dispenser that controls the speed, and a handpiece that is 20:1 reduction handpiece. Basically, this reduces the RPM, rotations per minute of the burr, by 20, the ratio 20, and it increases the torque by the force by which it rotates. Speed slow hai, but the force it is applying is more. Okay, and in this physio dispenser, we can set how much force can be used, how much rotations per minute can be done, or whether or not irrigation can be done, and if irrigation is done, what should be the speed of the irrigation. Okay. So in the last lecture, someone asked me that if we engage the palatal or the sinus floor, would it not lead to orodental communication? Who asked? Good question. It was a good question. But you have to remember one thing. It is a communication only if we breach the sinus membrane. If the sinus membrane is intact and there is no exchange of fluid and gases between the sinus and oral cavity, it is not a communication. One, even if we have a communication here, we have breached the sinus membrane, we are going to place the implant. मैं दिखाऊंगा बाद में. We are going to place the implant here. So we are closing the communication, right? There is no exchange of fluid or air between the sinus and the oral cavity. Okay, so there is no orodental communication here, even if we damage the membrane. I am going to cover this in complication section mostly on Monday. Okay, so this is the torque wrench. Somebody asked a question about the torque wrench. Who asked the question? You. Okay, it was a good question. वो next आगे की slides में explain हो जाएगा. Okay. So you've determined the amount of bone available in the patient's mandible or maxilla. Okay. So I'm going to show you the implant surgery demo. Based on before that, once you decide what amount of bone is available, based on that you decide the implant size that you're going to place. Okay. and every implant packaging is going to mention the size of the implant. So based on, suppose in our case, अभी जिसका मैं demo देने वाला हूँ, on a 3D printed mandible, I've decided that 5 mm diameter and 11.5 mm length dimension implant is to be placed. Okay, so based on that, there is a sequence of drilling, sequence of osteotomy. Okay, first either using a lance drill or a round burr, we are going to mark the site कि यहाँ पे implant place. Okay, then we start with the pilot drill, that is the 2 mm drill. Okay, now pilot drill से we are going to insert the drill to the required length, and beyond the pilot drill we are just going to expand the osteotomy. सब में आप देखेंगे the length is the same, we are just increasing the diameter. Okay, why? Now another thing, in pilot drill, you are going to, after using the pilot drill, you are going to place the parallel pin inside the osteotomy, and you are going to take a radiograph to check whether the angulation you are going in is correct or not. If the angulation is not correct, there is something called as Lindemann drill. I'll show you the images in the future slides. So that drill is a side cutting. These are end cutting drills, but the Lindemann drill is a side cutting. Suppose this angulation is going a little off. So what you can do is you can use a Lindemann drill and you can correct the angulation, and then you can expand the diameter of the osteotomy. Okay, and as I told you, 5 mm diameter implant is to be placed. So your osteotomy should be one drill size lesser than the actual implant site, because the implant should tightly anchor to the bone. Okay, if the osteotomy size is exactly the same as the implant size, it might be loose. So you're going to prepare the osteotomy size, in this case 4.3 mm, and you're going to place the implant 5 mm so that it tightly encourages the surrounding bone, so that you get the primary stability. Primary stability मैंने last time बताया था. It is just the physical, or you can say support from the bone, that the implant doesn't move. You need this primary stability so that the implant doesn't move for the next 3 months, and there is osseointegration occurring around the implant. Okay. So this is a 3D printed mandible, but you can assume this is the mandible of a patient. Okay. So what I'm going to do is I'm going to use a lance drill to mark the site where I'm going to place the implant. Okay. You can see I'm using a 20:1 reduction handpiece. Now the same thing can be done with a round burr. The site can be marked with a round burr also. Okay. So lance drill and round burr, they are both having the same usage. Okay, that is marking the site where we are going to place the implant. Okay, so you mark the site. Now this site was marked just to show you guys that the round burr can be used to place to mark the site. Okay, so this is the site where we are going to place the implant. Now we are going to use the pilot drill in the same direction where I use the lance drill. Okay, to the desired length, that is 11.5 mm. In pilot drill, you have to go till the required length. Okay, after this you're going to use you're going to take a radiograph to check for the angulation of your osteotomy. If osteotomy is not correct, you're going to correct it using a Lindemann drill. Okay, so you're going to use a parallel pin to check the angulation. Suppose, as I mentioned earlier, this is another example, you're drilling and you realize while taking the IOP, okay, the angulation is not correct. So what you can do, you can use a Lindemann drill. As it is side cutting, you can correct the angulation, and then you can continue your preparation along the correct angulation. Okay. So now I'm going to start with the sequential drills to the required drill. That is one size lesser than the implant size. Okay. Then you can read the dimension here. 3.4, 2.8. 3.4 is the upper diameter, and 2.8 is apical diameter. Then a 3.8 mm drill, we're just expanding the osteotomy site. Okay, and then the final sequential drill, that is 4.4 mm, in this case one size lesser than the implant size. So final drill, that is one size lesser than the actual implant size. Okay, so the osteotomy site is now prepared. Now we are going to place the implant. But before placing the implant, do you see the packing of this implant? ये packing में implant आता है. There are two packings. Okay. Outer packing is non-sterile, so you can touch it with bare hands. Okay. and ये packing के ऊपर everything is written, the diameter that is 5 mm, length 11.5 mm, okay. Then the insides, the content of this packing is sterilized, okay. So you're not supposed to touch the insides without wearing a sterilized glove, a surgical glove, okay. So when you're placing the implant, what you're going to do is you're going to keep a hand like this, the surgeon is going to keep his hand like this, and the other person who's not wearing gloves is going to open the packing and drop the content on the surgeon's hand without touching the insides. Look at this. So we are not touching the sterilized components, okay. So once this is done, the surgeon is going to open this cap. Now this cap is important, remember this, okay. So when we open this, you can see the implant here. You can see the implant that is inside. So the whole packing is in such a way that you don't touch the implant. The implant should directly, the first contact of the implant with the living tissue should be with the bone and the blood. Okay, usko touch nahi karna hai. Okay, now you see the implant. Now you're going to use an implant hand driver, attach it to the implant first, and then you're going to pick it out. Dekh raha hai? Again, I'm not touching the implant. Okay, so then, oh, I think I messed up. So okay, so I'm going to place the implant in the osteotomy side with the fingers. जितना tight कर सकते हैं उतना tight करेंगे. Okay. Once I feel I'm not able to twist the implant inside the osteotomy side with my fingers, then I'm going to use the ratchet. Okay, torque ratchet. इसमें I've already shown you that there are different levels, 10, 20, 30, 40, and then infinity also. Okay, so ideal torque to be set on the implant is around 50, but you're going to set the implant torque at the torque ratchet. The torque should be initially set at 30. Tighten the implant. Once that torque is reached, then you're going to increase it by 5. Then again tighten. Once you reach that, then you're going to increase it. 5 के steps पे increase करना है. Okay. Okay. So you can see here the torque is set at 30. Okay. So once this torque is reached, you're going to see this handle getting bent. Okay, that means that the 30 Newton centimeter torque has been achieved. Okay, now at this point, if I want, I can tighten it. Handle bend ho gaya, still I can tighten it, but I need to know kitne torque pe tight kar raha hu main. So I'm going to further increase the torque and then again attach it to the implant driver and then tighten it to know the exact torque kitna mera torque mein main tighten kar raha hu. Okay, आपको आंसर मिल गया कि यस ओरल कैविटी के बाहर ही सेट करते हैं टॉर्क. ओके, सो अभी मैं सेट नहीं करूंगा. आई एम जस्ट गोइंग टू टाइटन इट. नाउ देयर इज अ लिमिट. इफ यू सेट द टॉर्क, not this torque, if the implant is going in with a very high torque, okay, now torque, you have to push the implant at least to the level of the bone or at least 1 mm subcrestally below the bone. Okay, उस लेवल तक पहुंचाने में अगर आपको इतना ज्यादा फोर्स लग रहा है that your torque is reaching around 100, 120, this torque is very high. This is what this is going to cause is it is going to lead to pressure in the surrounding bone. Now if you remember, increased pressure leads to compromised blood supply, and compromised blood supply is going to lead to necrosis of the surrounding bone, and this leads to implant failure. This is called as pressure necrosis. Okay, again complications में वो आएगा. So if we leave the implant like this, just open, ऊपर से तो open ही है जहाँ पे हमने वो handpiece implant driver attach किया था. It is open, it is hollow, the implant is hollow. So if we just close the flap like that, blood is going to go and collect inside the implant, and there is a possibility कि वहाँ पे bone form हो जाए. Now if the bone forms inside the implant, this implant is of no use to us because we are not able to attach any components to the implant क्योंकि यहाँ पे bone form हो गई है. So we need to make sure that there is no blood collected inside. So what we're going to do is we're going to place a cover screw. Okay, this is a hex handpiece driver or hex driver. There are different types of hex drivers. Hand drivers भी आते हैं, handpiece में भी आते हैं. I'm showing you both. One implant driver hand का दिखाया था, इसमें hex का मैं handpiece driver दिखा रहा हूँ. So I told you this cap. Remember this cap. इस cap के अंदर we have the cover screw of the implant. Okay. Can you see the cover screw is now attached to the hex driver? Now this is going to be inserted on top of the implant. Okay. Oh, my bad. Okay. And RPM जैसा मैंने बताया था implant placement के time पे it is around 1200 to 2500 RPM, but in this the max RPM while placing the implant or while placing this cover screw should be 50. Okay. So, oh, बंद हो गया. Oh, stop working. Somebody has to stand here. आ जाओ. कौन आएगा? वासु. So after you place the implant, what you're going to do is you're going to take an IOPA to check whether the implant has been placed in correct angulation, correct depth. Okay, let me check. Oh, buttons here अटक गए. Okay, they are working. खड़ा रहे सही. ठीक है. So now I'm going to show you the actual clinical video. Next. Click. So this is one of the implant surgery performed in our department. So can you see? Initial lance drill osteotomy is done to mark the site. The site has been marked. So then the sequential drills are used, and then again the sequential drill to the 1 mm less than the actual osteotomy. Actual implant diameter. Okay. Now this is another company, Adin. जो मैंने पहले दिखाया था implant का delivery, that was Genesis implant. Now Adin दिखाओ. So again the same thing. Outer surface you can touch, but the inner contents cannot be touched as they are sterilized. Same way delivery is done. Surgeon is going to keep the hands like this, and the content dropped in to the surgeon's hand. Can you see in this implant? Implant driver is attached directly with the implant. पहले से ही attach होके आता है. कुछ में आता है, कुछ में नहीं आता है. Okay. Next. So this implant is now being placed. Next. Again, first you're going to tighten the implant in the socket with your fingers. So once you feel that yeah, this is not going inside anymore, then you're going to use a torque ratchet. In this case, it is not a torque ratchet, it is a plain ratchet without any torque setting. Okay. Next. Next. So the ratchet is attached, but in this there is no setting for setting the torque. Now look at this. When this is rotated like this, it is easily rotating. When you are rotating in the clockwise direction, it is you're getting a resistance. Okay, so you are pushing the implant inside while rotating it, right? Okay. Now with experience, you don't need a torque ratchet. Plain ratchet se bhi you will understand. Okay, this is approximately this much torque. Okay. So with experience, you don't need a torque ratchet, but it is always preferable to use a torque ratchet. Okay, जो मैंने दिखाया था पहले वो वाला. So you can see the implant has been placed. Next. Again, next. Like the previous demo, you can see the cover screw is placed in the same container. Okay. Now the cover screw is attached to the hex driver, implant hex driver. So implant's hex driver is, can you see now, the cover screw driver, hex driver. Now this video was shot with a mobile camera. पहले वाले वो chair camera से shoot किया था, इसलिए वो वाली quality अच्छी नहीं थी. So this is being attached with your hand. Okay. The same thing I showed you can be done with a handpiece also. Okay. So दोनों चीजें कर सकते हैं. Implant भी hand से place कर सकते हैं, handpiece से भी कर सकते हैं. Cover screw भी hand से place कर सकते हैं, handpiece से भी place कर सकते हैं. Okay. Next. So now implant has been placed. अब क्या करना है? कुछ नहीं. You wait for 3 months, right? So why do you wait for 3 months? You want the surrounding bone and the surrounding bone to heal and the implant to get osseointegrated. Okay. Next. So after 3 months, पीछे जा. After 3 months, पीछे. So after 3 months, you take a radiograph. Now that you're sure, after the radiograph, you're sure that okay, the implant has osseointegrated. Then what you're going to do is, you're going to open up the flap. Now it is totally the flap is totally closed, right? The implant is inside the bone. You need a proper collar of the gingiva around the tooth to receive the prosthesis, right? Abhi to wo pura closed hai. So we have something called as gingiva former or a healing abutment. So after 3 months, what you're going to do is you're going to raise a flap, you're going to place a healing abutment also called as gingiva former, because it forms a collar of a gingiva around the site. Okay, you expose the site, you remove the cover screw, okay, with a hex driver. Okay, these are all the different dimensions of gingiva former or also called as healing abutments. So these healing abutments are placed on top of the implant and then flap is closed around it. Okay, so and then let it continue. So the flap is closed around this gingiva former or a healing abutment. Now, as you allow this to heal, what happens is there's a beautiful collar formed of the gingiva around this abutment. Next. So after 7 to 10 days when the healing has occurred, next, when you remove this gingiva former, what you're going to see is a beautiful collar of the gingiva at the site. I'm going to show you the clinical picture of a gingiva of the collar. Next. This is how the implant site looks after removal of the gingiva former or the healing abutment. Okay. So now this is ready to receive a prosthesis. Okay. This step ke baad we are going to go for impression. Okay. Next. Go back. So this image was given to me by one of my senior from my BDS days, Dr. Akshay Raut from Pune. Next. So implant placement done. We have prepared the soft tissue to receive the prosthesis. Now we have to go for impression. Next. Now impression by definition is dental impression making is the process of creating a negative form of the teeth and oral tissue. Why do we want to create a negative form? Into which gypsum or dye material can be processed to create a working analog. Next. Now analog by definition is something similar or comparable to something else. Basically, we want to create a replica of the site where the prosthesis is going to be there, and the dental lab or the prosthodontist is going to prepare the prosthesis on that analog, and then he's going to send the prosthesis to you, and then you're going to place the prosthesis in the patient's oral cavity on the teeth. Okay, next. So we're going to take an example of the FPD. This is the crown cutting done to receive a prosthesis. Next. Okay. So we take an impression. Next. Okay. You pour the cast and you create the analog. Okay. When the cast comes out, this is the analog of also called as positive replica of the patient's oral cavity. Next. And on top of this, the dental lab or the prosthodontist is going to create the prosthesis, and we receive that prosthesis and deliver it to the patient. Next. And we reach this. Next. And so basically this is the analog of this. Okay. So we need to somehow do the same thing with the implants. We need to transfer the same, either the prosthesis receiving area or the implant connection or the implant site into the cast. Okay. Uske bahut sare alag techniques hain. We're going to talk about those. Okay. So as I told you, we have to replicate the patient's oral condition to the cast, including the implant. Okay. Now implant is very costly. Titanium ka banta hai. Okay. So we can't just give another implant to the lab guy. Okay. We are wasting one implant. So for that, we have something called as implant analog also. Next. So do you see the implant inside the 3D printed mandible? Do you see this? The outer surface, we have a hex connection, 6 sides, so it is a hex connection. Whereas insides, there's a thread. There are threads to receive a screw, right? So next, there's a dental implant analog. Bahar se the outer surface is different. It is made up of stainless steel, so it is comparatively cheaper as compared to titanium implant. But it has the outer connection that is same as the implant, and it has the inner threads also that is same as the implant. So the inner connection is the exact replica of the implant. It's just the outer surface is different. But we want only this. Bahar ka kuch kaam nahi hai, because once this is inside the cast, this is what remains that we are going to use, which is same as that of the implant. ये क्यों होता है ऐसा? Okay, it started. Okay, next. Okay, so can you see this? Implant has a hex connection, analog has a hex connection. Implant has threads, analog has threads, right? Next. Outer surface अलग था दोनों का, but inner connection is the same. Now, you already know implant placed here in the patient's oral cavity. Now we need to place the abutment on top of the implant, on top of which we are going to place the prosthesis. Okay, next. So we have different types of implant abutments. So confuse नहीं होना, अलग slides में अलग अलग photos दिखाऊं तो, okay? ठीक है. So that is the problem. I know कहाँ पे क्या click करना है, but he doesn't know. He is not at the fault. Okay, so can you see these are all different shapes, sizes, designs, different designs. In fact, you have angulated abutments also. Straight की जगह you have angulated abutment to correct the mistakes. अगर आपने angle थोड़ा गलत डाल दिया implant का, okay, and you realize it after placing the implant, you're not going to take it out, right? What you're going to do is you're going to use an angulated abutment to correct the angulation. Okay, next. So continue. So you're going to place the abutment in the site that is prepared for receiving the prosthesis. Okay, the collar was formed and we placed the abutment. Okay, this abutment was prepared in the oral cavity. Now the first method is you just place the abutment just like FPD. इसका impression ले लो. So on the stone you're going to use you're going to get this shape. Okay, next. And उसका impression लिया and the dental lab fabricates the prosthesis on top of the stone. उसमें हमने analog use नहीं किया है अभी तक. We just took the impression. This shape is also replicated with the stone. Okay, in the cast. So this is a direct abutment impression. Next. Now the advantage is, of course, there will be some distortion. It is less flexible because when we come to the prosthetic part, there are two types of prosthesis, two types of crown. One is cementable crown, जो cement से directly चिपका देंगे, and then we have the other option that is screw retained crown, कि screw से उसको tight कर रहे हैं, उसको वहाँ पे पकड़ के रख रहे हैं. Okay. So when you use direct abutment impression, you have only the option of cement retained or cementable crowns, not screw retained. So you have less flexibility. Okay, and if the implants that you placed are not parallel to each other, ideally they should be parallel. If the implants are not parallel to each other, you cannot use this impression technique. Okay, so this is one of the least preferred technique. Next. Then there are two other techniques, that is closed tray impression technique and open tray impression technique. Now, before I continue with the closed tray technique or open tray technique, I would like to thank the Department of Prosthodontic, Dr. Manish Chadda sir and Nikhil. They both helped me. They both helped me with the clinical demonstration of the impression techniques, जो मैं अभी आपको दिखाने वाला हूँ. Animations मैंने बनाई, but they did the actual work, जिसको मैंने shoot करके edit किया. Okay, तो and this lecture has been prepared in collaboration with the the Department of Prosthodontics. So Nikhil is going to cover this impression prosthesis in detail on Tuesday or Wednesday. Okay, after my topic is over. Next, so closed tray impression technique. Next, so there is something called as a closed tray impression post or closed tray impression coping. Post bolo, coping bolo, they are one and the same thing. Okay, so can you see this thread and this hex connection? So this is going to go inside the implant. Okay, next. So these are going to go inside the implant. I am going to show you the impression technique with this one. Okay, Rukja. So I showed you two impression posts just to let you guys know that there are different shapes and sizes and designs available for different systems. Okay, डरना नहीं है. The underlying concept is the same. Okay. So next. So first I am going to show you. Click. Can you see this? Closed tray impression post. So this single screw goes through and through the impression post, and this is a cylindrical body of the impression post. इसमें can you see there are no flanges, there are no huge undercuts. Okay, so this helps in inserting the post inside the impression material and then taking it out also without causing much of a deformation. Okay, next. So now I'm going to show you how we attach the impression post, that is closed tray impression post, to the implant analog. Okay, the same way you can attach it to the implant also. So just screw is tightened and वो screw इसके अंदर जो threads थे उसमें tighten हो जाता है and this becomes a single unit. Okay, simple enough to understand. Next, So I'm going to show you first the animation, then clinical demonstration. Now, we place the implant inside the patient's mandible. Okay, this is just to show you guys there's an implant inside the body of the mandible. Next. Okay, we attach the impression post, close to impression post on top of the implant. Okay, then we take an impression. This is the impression tray. Okay, this was tightened with the hex driver on top of this, right? When we take out the impression, this is going to create a indentation inside the impression, right? Increase next. So this impression post left an impression in the inside this. So now what we are going to do is we are going to remove the impression post from the implant. We are going to attach it to the implant analog. Next. So implant analog is attached. Now we are going to insert it back into the impression. So now we are going to pour the cast. We pour the cast. Now this impression and the implant analog is now attached. It is now embedded inside the cast. Okay. Now when we remove the impression, as this is tightly attached to the implant analog, this is also going to come out along with the analog. Next. Okay. Now we're going to remove this. Next. Okay. So now we have accurately transferred the position of the implant and the connection to the cast. Okay. Samajh aaya? So this was your closed tray impression technique. Next. Now on top of that we place the abutment. Not we. Basically your work is you take the impression, you give it to the lab or the prosthodontist. He is going to pour the cast. He is going to do all the work after the impression steps. Okay, you don't have to do anything. Massive steps bata raha hu kya kya hota hai. Okay, so you also have to give the abutment to the lab or the prosthodontist. Now once we attach the abutment to the analog, next, we have to reshape it क्योंकि अभी तो उसकी height भी ज़्यादा थी. You have to reshape it to the proper height and shape, and then a crown is formed on top of that abutment. Okay, and then this abutment and crown is removed from the analog and delivered to you in the clinic. Okay, and then you deliver to the patient. Next, you place it on top of the implant, and the patient now has a fixed tooth without damaging any surrounding teeth. Okay, next. So this is how we go from this to this using closed tray impression technique. Next, sir. Now I'm going to show you the clinical demonstration of the closed tray impression technique. Jaldi. So remember, gingiva former वहाँ पे था. Okay, you're going to remove the gingiva former, and then you're going to attach the impression post, closed tray impression post. Now this ये जो चल रहा है, this is being done by Nikhil. ये बहुत लंबी लंबी वीडियोस थी. I had to edit them. Luckily वो बच गया. I was able to take a backup, but rest of all the data, 30 GB data is gone. Yeah, so we have attached the closed tray impression post to the implant. Okay, next. So now we are going to do, what we are going to do is you are going to use an impression putty. Next कर दे. You are going to mix the two components of the impression putty 1:1 ratio में, and you have to mix them until you see the consistent color. Okay. Again, ये निखिल detail में जाएगा. I am not a very confident person with these things. So you have to take both the components in 1:1 ratio. Okay. Now you have to mix it, knead it until you start seeing the actual proper consistency, uniform consistency, and then you place it in the tray. Now in this, do you see there is no hole? I mean, there's no huge holes inside the tray. Now you're going to use a light body impression material to pour it around the impression post, that is closed tray impression post. Okay, now this is the clinical demonstration of the animation that I just shown you. Okay. Okay. So we place it. So light body is used to make sure that we get all the details of the surrounding teeth and the impression post. Okay, next. So now once the material has set, next we are going to lift it off and you're going to see that the impression post is still attached to the implant. Okay, and because of the shape, if you remember, there was grooves on the impression post. Now we're going to take out the impression post, attach it to the dental implant analog, and then you're going to push it back inside the impression material. Can you see? Now the screw will be tightened with a hex driver. I think this lecture is going to go beyond Monday. ज़्यादा लंबा हो गया. So can you see? You have to remember the indentations of the implant impression coping, impression post, and you have to push it inside in that direction only. And you have to check whether it is rotating or not. If it is rotating, you have to repeat your impression. If it is not rotating, if it is stable, then you can go and pour the cast. Again, let me remind you, this is what you are supposed to do in the clinic. इसके बाद you have to send the impression to the dental lab or your prosthodontist. आगे के सारे steps are going to be done by the prosthodontist or the dental lab, prosthesis वाला, okay? But you should know आगे क्या होता है. Next, okay? Next, I'm going to show you the impression technique, close to impression technique. I guess you guys understood. Animation देखना है? फिर से देखना है तो ये दिखा देते हैं. चलो. So can you see, this is a different shape of a close to impression post. पहले वाला अलग था, ये वाला अलग है. This has a flat surface only on the one side. So again, light body is placed and then impression tray is placed. Once it sets, you pull it out. This is still connected to the implant. So you take out the impression post, connect it to the implant analog. Can you see? Implant analog is being attached and then checking where this flat surface is. So can you see this? This flat surface, this flat surface. You have to make sure the direction is correct. Okay? And then next, you're going to place it inside the impression and then you're going to pour the cast. Okay? Once you pour the cast, you get something like this. Although मैंने मेरे वीडियो में नहीं दिखाया था, there's something called a gingiva mask to recreate the gingiva around the implant. In this, it is shown that we have created the gingiva around the implant site. Okay, again that will be covered by Nikhil. Next, so that was close to impression technique. We created the same connection. We transferred the same connection to the cast, the same position and same connection. Next, and can you see? This is the patient's mandible and this is the cast. You have the same connection, same position of the implant using the analog. Okay, next. Okay, but इसमें भी disadvantages हैं. You're taking out the impression post, again putting it in, so that can lead to some deformation. Okay, that is one problem, and then you are not able to use it usually in non-parallel implants. Again, non-parallel implants के लिए the techniques used are open tray impression technique or digital impression. Next. So this is the open tray impression coping. Next. So can you see, this is the screw, very long screw going through and through a cylindrical open tray post. Okay, next. So again, I'm going to show you how we attach the open tray impression post to the dental implant analog. So we attach it and the screw is so long that we can tighten it with your finger also, and then final tightening can be done with a hex driver. Okay, next. So now again the same thing. We have the mandible with the implant inside it. Next. So we place the impression post, open tray impression post here. Then we tighten it with the hex driver. Okay, now for this, because this is so long, you need a specialized tray. You need a specialized tray in which we have holes to accommodate this length, this post. Okay, next. So when you place the impression tray with holes in it, this screw is jutting out of those holes. Okay, then you have to remove the impression material on top of these. Next. Okay, then what you're going to do is, next, you're going to use a hex driver to loosen this screw. So once you loosen the screw, next, so once you loosen this screw, now this becomes detached from this. Impression post is not now tightly connected to the implant, right? So when you pull the impression out, this is going to take this impression post along with it. So we are not taking out the impression post, so there is no deformation. Okay, next. So we separated it and the impression post is tightly embedded inside the impression. Okay, now we are going to attach it to implant analog. Next, you attach it to the implant analog. Next, then you pour the cast. Of course, analog se attach karke tight kar diya, then you pour the cast. Next, once you pour the cast and then you loosen this. Okay, so when you take the impression, this comes out. Now when you pour the cast, the dental implant analog is tightly embedded inside the cast. Okay, next, next. Okay, so now again you have replicated the implant connection to the exact site in the implant, in the cast. Okay, next. So again, जैसा मैंने बताया, your work is still only the impression. You send it to the lab is going to do the further work. Now you attach the abutment to the implant analog, you cut it, you reshape it, and then you fabricate the crown. And then once the crown is fabricated, the lab delivers the crown and the abutment to the dental clinic, and then the clinician, you are going to deliver it to the patient. So this is how you go from this to this with open tray impression. So you remove the gingiva former, 5 minutes hai, jaldi karenge. Then you attach the open tray impression post to the implant. Okay. Once you attach the open tray impression post to the implant, again tighten it with the hex driver. Then you're going to take the impression. Now, either you can create a custom tray for the impression taking, जो अभी दिखाएंगे. Now, can you see a hole has been prepared in the tray to receive this impression post. Okay, open tray. That is why it is called as open tray impression post, because the impression is being opened at some site to receive the post. Now, this is a custom tray prepared for the same thing. Okay. Next, time mix. So you mix the putty impression material, and then you place it in the tray. Trust me, this was very confusing to me a few years back. I didn't want you guys to face the same confusion. Okay, again the light body impression material is applied to the impression post, and then impression is being taken. Okay, 5 minutes remaining. So again you are going to remove the screw, so that when you take out the impression post comes out along with the impression. Next. So you pick up. This is also called as pick up impression, because we are picking up the impression post along with the impression. Can you see this? This is the impression post that is tightly embedded inside the next. So this is the impression post. So now we are going to attach the analog to the impression post that is tightly embedded inside the impression material. Okay, so there is no risk of deformation because it is tightly attached inside. उसको हम निकाल नहीं रहे, वापस नहीं लगा रहे. Okay. Again, oral surgery में prosto सिखा रहे. Okay, then we pour the cast and you replicate the exact position of the implant connection, implant site. Okay, next कर दे. Okay, so this is the animation. I'll show you and then we'll end this lecture for now. So again, open tray impression post is placed here. Can you see the screw so long that it comes out of the impression tray? So we pour the light body impression material on top of the open tray impression post. The same thing, we take out the screw, we pull the impression out, the impression post is coming out along with the impression material, you attach the implant analog and then you pour the cast. Okay. Any doubts till now? I hope I tried to make it as simple for you guys as possible. And then you pour the cast and you replicate the exact position of the again implant and the connection angulation. So again, gingiva form or gingy mask is used to recreate the gingiva around the site. Next. So next. So you've created dental lab mein, this is inside the cast. The lab technician or the prosthodontist is going to receive the abutment, reshape it and deliver the prosthesis. Next. Next. Okay. So now I feel we should end at this. There's one more impression technique remaining, that is digital impression, जो next Monday बात करेंगे. And I'm going to talk about the complication and if possible some recent advances. Most probably I'll try to complete this lecture series on Monday. नहीं हुआ तो फिर Saturday तक तो है ही. ठीक है? Done.